So here we're looking at the front of the hip. The femoral head is to the right. The acetabulum is to the left. The labrum is that structure that we're probing right here, because you can see there's some fraying anteriorly or in the front there, and there's some instability, some tearing up here on top. So this is an anterior and anterior superior labral tear with delamination. Looking at the back, it looks pretty normal. No problems back there, but the front's obviously torn, unstable. We're going to fix that, okay? So what we'll do first is we'll drill our anchor holes, and then we'll start passing our stitches. So here's a stitch going through using a special device to pass that stitch through your labrum. And what we'll do is we'll grab it on the other side and secure the labrum and the little cartilage wave sign there with one stitch there. So we put this into a anchor that goes into the bone. The anchor is a suture anchor that basically secures that suture against the bone, and we can tension it, and that will secure the labrum against the bone and against the acetabular rim and restore the anatomy and restore the stability of that labrum. So that's where the pain comes from, and hopefully by stabilizing it, that pain will get much better and this will heal. So here's a final picture of the repair. As you can see, we placed anchors across the front of your hip. Looks like 1, 2, 3 anchors across the front of your hip, and that should hold things in place while it heals. These are nice and secure, sturdy anchors. The actual diameter of that anchor is 2.4 millimeters, just to give you a sense of size. So we're going to put the femoral head back into the socket now. So there's the ball going back in the socket. The labral seal is reestablished. Now looking at the outside, this is the femoral deformity. We call it a cam. You can see on the x-ray there, we're marking it. And that's what we're going to need to correct for you in order for this hip to fit in there better. What happens is the outer round portion of the femur, or the aspherical portion of the femur, rubs against that labrum and causes that tearing. So here we're taking a burr, a high-speed burr, and we basically smooth it down and make it as round as possible. As you can see, we're just trying to make it into a ball shape as opposed to what it was formerly was an egg shape. And so once we get it completely burred down, this takes a little bit of time. You can see the labrum's reformed its nice seal. The femoral head and neck has been reshaped so that it's no longer oblong. It's no longer sort of watermelon shape. Now it's nice and round. And what we'll do is we'll check on x-ray, different shots to make sure we like what it looks like. So here's the x-ray right here. Top right, you can see the ball is nice and round. And that's going to make it so your hip fits in there a lot better. So there's your final picture of your labral seal. We do close the capsule there at the end, and so what we've done is we've placed these stitches across the capsule. That's just one portion of the capsule closure. We actually end up doing a complete capsule closure in your case to make sure that we restore the anatomy back to where it came from. So here are the final x-rays. Here's your before x-ray showing that cam deformity. You can see that sclerotic area, the area where it was rubbing. And then here it is after we've shaved it down, made it nice and round for you. So hopefully you start feeling better here soon and you heal up and return.